Hello everyone and welcome. I'm Dr. Maheen and I'm glad to have you here today. We're about to explore an important health topic, pneumonia. This is the first slide, which is our cover slide. I'll briefly introduce what we'll cover in this presentation. We'll look at what pneumonia is, its causes, symptoms, prevention, and treatment options. So let's get started and dive into this essential subject. Pneumonia is a serious lung infection that involves inflammation of the air sacs in the lungs, and it can affect either one lung or both. This condition is caused by different types of pathogens, including bacteria, viruses, and fungi. Because of these infectious agents, the lungs respond with inflammation, which often leads to symptoms like a cough, fever, and difficulty breathing. The difficulty breathing usually happens because fluid builds up in the lungs, making it hard for oxygen to pass into the bloodstream. Understanding pneumonia is crucial because it highlights how infections can impact lung health and overall well-being, which ties into our broader discussion of respiratory illnesses and their management. Pneumonia is an infection that affects the lungs, specifically causing inflammation in the tiny air sacs called alveoli. These alveoli are crucial because they are where oxygen passes into your blood and carbon dioxide leaves. When they become inflamed, it can happen in just one lung or both lungs, depending on the severity and cause of the infection. The inflamed alveoli may fill up with fluid or pus, which makes it much harder for oxygen to get into your bloodstream and for you to breathe easily. That's why symptoms like cough, fever, chills, and difficulty breathing are so common with pneumonia. Understanding what pneumonia is helps us see how serious and disruptive this infection can be, especially since it impacts essential lung function. It's a good reminder of why early recognition and treatment are so important, fitting into our overall theme of prevention and management of respiratory infections. Let's take a closer look at the causes behind this issue. First, it's important to understand that these causes are often interconnected, contributing to the overall problem. One major factor is *insert key cause, e.g., increased demand *. When demand rises rapidly, it can put a lot of pressure on resources and systems, leading to strain and potential failures. Another critical cause is *second key cause, e.g., lack of proper infrastructure *. Without the right infrastructure in place, even moderate levels of activity can become problematic. This highlights how essential it is to invest in robust systems to manage growth effectively. Additionally, third cause, e.g., ineffective policies or regulations, can exacerbate the situation. When policies are outdated or not enforced properly, it leaves gaps that can lead to issues spiraling out of control. Connecting these points to our overall theme, understanding these causes helps us see where interventions are needed. Addressing these root issues is key to finding sustainable solutions and preventing similar problems in the future. Many germs can cause pneumonia, and the most common ones are bacteria and viruses that are present in the air we breathe. Usually, our bodies have a strong defense system that prevents these germs from infecting our lungs. However, sometimes these germs can be strong enough to overcome our immune defenses, even if we're generally healthy. Pneumonia is classified based on two main factors: the type of germ that causes it and where the infection was acquired. Understanding these classifications helps us better grasp the different forms of pneumonia and how they may affect us. So, when we talk about types of pneumonia, we're really looking at the specific germs involved and the environment or location where the infection originated. This classification is key to choosing the right treatment and managing the condition effectively. Community-acquired pneumonia is actually the most common type of pneumonia that we see. It happens outside of hospitals or healthcare facilities, which makes it quite prevalent in the community. Now, it can be caused by several different organisms. The most common cause, especially in the United States, is bacteria, with Streptococcus pneumoniae leading the way. This type of pneumonia can sometimes develop on its own, or it can follow a cold or the flu. Interestingly, it often affects just one part of the lung, which we call lobar pneumonia. Then we have bacteria-like organisms, such as Mycoplasma pneumoniae. This one tends to cause milder symptoms compared to other bacterial pneumonias. In fact, it's often called walking pneumonia because people usually feel well enough to keep moving around, and it typically doesn't require bed rest. Fungi are another cause, but they tend to affect people with weakened immune systems or chronic health issues. These fungi are often found in soil or bird droppings, and the risk can vary depending on where you live geographically. Finally, viruses, including those that cause colds and the flu, can lead to pneumonia too. This is especially common in young children under 5 years old, where viral pneumonia tends to be milder. However, in some cases, it can become quite serious. And as we've seen with COVID-19, viral pneumonia can sometimes cause severe illness. So, understanding these causes helps us better recognize, prevent, and treat community-acquired pneumonia effectively. Some people catch pneumonia during a hospital stay for another illness, which is what we call hospital-acquired pneumonia. This type of pneumonia can be especially serious because the bacteria responsible are often more resistant to antibiotics, making treatment more challenging. Additionally, since these patients are already sick, their bodies may be less able to fight off the infection. It's also important to note that people who are on breathing machines or ventilators, particularly in intensive care units, are at a higher risk of developing this kind of pneumonia. This highlights how vulnerable patients can become during their hospital stay, emphasizing the need for careful prevention and management strategies. Now, let's talk about healthcare-acquired pneumonia. This is a bacterial infection that occurs in people who live in long-term care facilities or who receive outpatient care, such as in clinics or dialysis centers. It's important to recognize that, just like hospital-acquired pneumonia, this type can also be caused by bacteria that are more resistant to antibiotics. This resistance makes treatment more challenging and highlights the importance of infection control and proper antibiotic use in these settings. Understanding these infections helps us see how they fit into the broader picture of healthcare-associated infections and the ongoing efforts to prevent them. Aspiration pneumonia happens when something like food, drink, vomit, or saliva accidentally goes into our lungs instead of staying in the stomach. It's a serious condition because those foreign substances can cause infection and inflammation in the lungs. Now, the risk of aspiration increases if your normal gag reflex is disrupted. This can happen due to brain injury, or if you have difficulty swallowing, which is quite common in certain health conditions. Additionally, excessive use of alcohol or drugs can impair your ability to protect your airway, making aspiration more likely. Understanding these factors is important because preventing aspiration is key to reducing the risk of pneumonia, especially in vulnerable populations. Throughout this presentation, we've discussed how various health issues can contribute to pneumonia, and aspiration pneumonia is a perfect example of how interconnected these factors are. Now, let's talk about some of the symptoms that can indicate a respiratory infection or pneumonia. One common sign is a cough, which may produce phlegm or even pus. This can be a clear sign that your lungs are fighting an infection. You might also experience fever, sweating, and chills. These are your body's way of responding to the infection and trying to fight it off. Shortness of breath or rapid, shallow breathing can also occur, especially if the lungs are compromised. This can make even simple activities feel exhausting. Chest pain that worsens with breathing or coughing is another important symptom to watch for. It often indicates irritation or inflammation in the chest lining or lungs. In addition, you might notice fatigue, a loss of appetite, or even confusion, particularly in older adults. These symptoms can sometimes be subtle, but are important indicators that something serious might be happening. And in severe cases, you might see bluish lips or fingernails. That's a sign that oxygen levels are dangerously low. Recognizing these symptoms early is crucial for prompt treatment and better outcomes. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a closer look at risk factors. These are the elements that can increase the likelihood of adverse outcomes or complications. Identifying these factors is crucial because it helps us understand where we might need to focus more attention or take preventative measures. Some risk factors are related to the patient, such as age, underlying health conditions, or lifestyle choices. Others are more about the environment or the procedures involved. By thoroughly understanding these risks, we can better tailor our approach to minimize potential issues. Remember, recognizing risk factors doesn't mean we're doomed to face problems, but it does give us an opportunity to be proactive and strategic in our planning. This connection between risk factors and overall safety underscores the importance of comprehensive assessment and vigilance in our practice. This slide doesn't contain enough information. That's why we're moving to the next slide. Even with treatment, it's important to understand that some people with pneumonia, especially those in high-risk groups, can still experience complications. One such complication is bacteria entering the bloodstream, known as bacteremia. When bacteria from the lungs spread through the blood, they can reach other organs and potentially cause organ failure, which is very serious. Another concern is difficulty breathing. If the pneumonia is particularly severe, or if someone already has chronic lung issues, they might struggle to get enough oxygen. In these cases, hospitalization might be necessary, and they could need a ventilator to help them breathe while their lungs heal. Fluid accumulation around the lungs, called pleural effusion, is also a common complication. This happens when fluid builds up in the space between the layers of tissue lining the lungs and chest cavity. If this fluid becomes infected, it might need to be drained using a chest tube or, in some cases, removed through surgery. Finally, there's the possibility of developing a lung abscess. This is a pocket of pus that forms within the lung tissue. Usually, antibiotics can treat an abscess, but sometimes more intervention is needed. That could mean draining the pus with a needle or tube, or even surgical removal in more severe cases. So, while antibiotics and treatment are effective, understanding these potential complications helps us stay vigilant and ensures prompt medical attention if needed. To help prevent pneumonia, it's really important to get vaccinated. Vaccines are available that can protect you from some types of pneumonia as well as the flu. I recommend talking with your doctor about which shots are right for you. Keep in mind that vaccination guidelines have changed over time, so even if you've received a pneumonia vaccine before, it's a good idea to review your vaccination status with your healthcare provider to ensure you're up to date. It's equally important to make sure children are vaccinated too. Doctors recommend a different pneumonia vaccine for children under 2 years old, and for those between 2 and 5 years who are at higher risk of pneumococcal disease. Children who attend group childcare centers should also receive this vaccine. And for children over 6 months, flu shots are strongly recommended to help protect them from respiratory illnesses that could lead to pneumonia. Practicing good hygiene is another key step. Regular hand washing or using an alcohol-based hand sanitizer can significantly reduce your risk of respiratory infections. These infections can sometimes escalate into pneumonia, so staying clean helps keep you safe. Avoid smoking because smoking damages your lungs' natural defenses against infections. When your lungs are compromised, it becomes much easier for pneumonia to take hold. Finally, keep your immune system strong by getting enough sleep, exercising regularly, and eating a healthy diet. A robust immune system is your body's best defense against all kinds of infections, including pneumonia. So, by staying up to date with vaccines, practicing good hygiene, avoiding harmful habits like smoking, and maintaining a healthy lifestyle, you can greatly reduce your risk of pneumonia and stay healthier overall. Thank you for joining me as we wrap up today's presentation. In this conclusion, I want to highlight the key points we've discussed throughout. We've explored the main concepts thoroughly, and I hope you've gained a clear understanding of how these ideas come together. Remember, the most important takeaway is the connection between these concepts and the overall theme of innovation and growth. It's about applying what we've learned to make meaningful progress. So, keep these ideas in mind as you move forward, and don't hesitate to revisit the material for deeper insight. Thanks again for your attention and engagement.